Diphtheria. So the bacteria responsible for this disease produces a toxin that damages human body tissues and organs. It commonly affects the tonsils and sometimes the skin, causing ulcers. And it's spread mainly by respiratory droplets from person to person and less commonly through skin contact. Infected patients may recover after initial symptoms and signs or develop severe weakness and die within 6 to 10 days. Complications may develop in the early phase of the disease or weeks later, such as abnormal heartbeat and heart failure, damage to valves of the heart, or respiratory obstruction, leading to death. The disease is now uncommon because of immunization. However, high immunization coverage needs to be maintained to keep the disease under control because it has a high mortality rate. So the main causes Corynebacterium diphtheria, and the symptoms are sore throat, loss of appetite, slight fever, dysphagia, difficulty in breathing, with or without stridor. The signs that are usually elicited are grayish white membrane or patch in the throat and on tonsils within 2 to 3 days of the onset of the symptoms. The membrane may bleed, become grayish green, or even black. Investigations are throat or nasal swabs for culture, for index case and close contacts, and repeat swabs after antibiotic treatment course. And treatment may need to be extended. So the main treatment objectives are to neutralize the effects of circulating antitoxins before they become fixed to the tissues, and to provide supportive care, respiratory and feeding where indicated. Also to eradicate the organism from the pharynx and to prevent spread. Non-pharmacological treatments, bed rest, feeding by nasogastric tube for patients who cannot swallow, also strict isolation of suspected patients. And for pharmacological treatment, all patients clinically diagnosed with diphtheria, you give diphtheria antitoxin, IV infusion, following an intradermal test dose of 0.1 ml in 1 in 10 dilution of antitoxin in sodium chloride 0.9%. In adults, give 10,000 to 20,000 units, and in children more than 10 years, give 10,000 to 20,000 units, and less than 10 years, 5,000 to 10,000 units. Okay, so reactions are common, so resuscitation facilities should be available immediately. So after giving the antitoxin, you give benzyl penicillin IV as you give in adults 1.2 gram 6 hourly for 48 hours, and in children and units 1 month to 18 years 50 milligrams per kilogram 6 hourly for 48 hours. And then you give amoxicillin oral in adults 1 gram 12 hourly for 5 days, and in children between 5 to 18 years you give 500 milligrams 12 hourly for 10 days. 1 to 5 years, give 250 milligrams 12 hourly for 10 days. 1 month to 1 year, you give 125 milligrams 12 hourly for 10 days. Or you can give azithromycin oral in adults 500 milligrams daily for 5 days, and in children 10 milligrams per kilogram body weight daily for 5 days. It's not recommended for children less than 6 months because of a risk of pyloric stenosis. And all close contacts, you give amoxicillin oral for 14 days with the same dosage, and also for patients who may not tolerate penicillin, as penicillin allergies, you give azithromycin oral for 5 days with the same dosage I mentioned. Referral criteria: refer patients with laryngeal obstruction or respiratory paralysis to an ENT specialist.